Between the 14th and the 16th of June 2021, 3 students presented to the Achimota School sick bay with an influenza-like symptom like cough and fever, among others. All 3 were investigated for COVID-19 in line with the laid down protocols. The 3 tested positive, prompting the activation of the Public Health Emergency Response Team of the Greater Accra region, and led by the Okaikwe North Municipality where the school falls. All 3 students were isolated following existing protocols. Other symptomatic students, which are contacts, were identified and listed and also tested for COVID-19. And all the contacts before doing testing was put under mandatory quarantine until the results came. So far, as at the 3rd of July, because of an enhanced approach to trying to contain the situation, we've done about 843 students and staff have been sampled. 348 of them are boarding students, 459 are day students, 36 of them are teaching and non-teaching staff have been tested. We have received results for about 550 samples out of the 843 samples. In fact, yesterday, about 250 samples were taken. And so those are the results we are waiting. I'm sure by the end of the day, the results will be in and be able to come out more clearly. So far, of the 550, 135 tested positive. So we are waiting for the 293 samples, which were collected yesterday from day students. All the 135 cases at the time of diagnosis were either asymptomatic or had very mild to moderate illness. 1 staff was also recorded positive, and about to test, that's about 89 students and staff have recovered, accounting for 65.5% so far. So the active case, the number who are still carrying the virus, about 46, as I mentioned earlier. These things came about because at the initial assessment by the health sector, we realized that the adherence to the protocol was significantly low, and so a lot had to be done to look at that. The health education on all public records has been intensified for both day and day students, and then the students and the teachers. We review the cases daily, and discharge of eligible students are being done based on our discharge policy. That's 14 weeks, 14 days from the day we tested positive. We have intensified enforcement of the infection prevention and control practices on campus, and disinfection of all places of concern are being done. Classrooms, vehicles, etc. are all being done currently. We've also had to do some strategic testing of all these students to identify and contain the community spread, because Achimota overall has about over 800 day students who commute daily. For the current situation, about 500 students are day, and so if there's an outbreak there and they are going home and they are coming back, it's a group of concern to contain community spread, and that is why we've had to test all day students from that. So far we've tested nearly 500 of them. The number that has come in of about 221, we've seen about 21 of them are positive, which adds to the active cases that we have now. And so that is the way that we're now going to follow them up to their homes and see how we can enhance contact tracing and do further testing for their contacts, and at the same time those borders and things that they've come in contact with be tested. Just this is to help assist us bring the outbreak to an end. So that's it for Achimota for now. I think there are going to be further, not just for Achimota, but we expect that all schools will adhere to the protocols to ensure that we don't have any further outbreaks.